Schizophrenia is a chronic illness characterized by profound functional impairment, with symptoms falling into positive, negative, and cognitive categories. Positive symptoms involve excessive or distorted functioning, such as hallucinations, delusions, unusual thought processes, disorganized speech, and bizarre behavior. Negative symptoms manifest as diminished functioning, including flat affect, apathy, anhedonia, alogia, and social withdrawal. Cognitive symptoms include a reduced ability to understand or make plans, diminished working memory, and inattention. Diagnosis requires the presence of at least 2 active symptoms, including at least one from symptoms 1 to 3, delusions, hallucinations, often auditory, or disorganized speech. The onset of symptoms must be at least 6 months prior to diagnosis, with a requirement of at least 1 month of active symptoms over the past 6 months. The acronym Delusions High Definition Day and Night, DHDDN, serves as a mnemonic aid for remembering key diagnostic criteria. Schizophrenia is associated with altered dopaminergic activity, high serotonergic activity, and low dendritic branching, as well as ventriculomegaly on brain imaging. The lifetime prevalence is 1.5%, with males predominantly affected compared to females. Onset typically occurs earlier in males, late teens to early 20s, than in females, late 20s to early 30s, and the condition is associated with an increased risk of suicide. Heavy cannabis use in adolescence is linked to an increased incidence and worsened course of psychotic, mood, and anxiety disorders. The first-line treatment for schizophrenia is atypical antipsychotics, such as risperidone. However, negative symptoms often persist after treatment, even when positive symptoms resolve. Brief psychotic disorder is characterized by at least one positive symptom lasting between 1 day and 1 month, usually stress-related. Schizophreniform disorder involves at least 2 symptoms lasting 1 to 6 months. Schizoaffective disorder shares symptoms with both schizophrenia and mood disorders, MDD or bipolar disorder, and requires at least 2 weeks of psychotic symptoms without a manic or depressive episode to differentiate it from a mood disorder with psychotic features. Delusional disorder features at least one delusion lasting more than 1 month, without a mood disorder or other psychotic symptoms. Daily functioning may be impacted by the fixed belief, but socialization is otherwise unaffected and can be shared by individuals in close relationships, folie à deux. Schizotypal personality disorder, falling under cluster 8 personality disorders, is also on the schizophrenia spectrum. It may include brief psychotic episodes, such as delusions, which are less frequent and severe than those observed in schizophrenia. Conclusion. In conclusion, schizophrenia spectrum disorder's intricate web of symptoms and its far-reaching consequences underscore the pressing need for comprehensive research, compassionate care, and destigmatization. As we navigate the complexities of altered neurotransmitter activities, ventriculomegaly, and the nuances of symptomatology, it becomes evident that a holistic approach is crucial for effective management. The persistent nature of negative symptoms post-treatment and the association with heavy cannabis use in adolescence raise critical questions for future exploration. Ultimately, by fostering a deeper comprehension of schizophrenia, we can contribute to more effective interventions, diminish societal misconceptions, and offer hope to those grappling with the challenges of this enigmatic disorder.